Welcome to your educational guide for your total joint replacement. The goals of this video are to provide education regarding expectations following surgery, such as length of stay in hospital, which is usually 1 to 3 days. How you can prepare for your surgery by learning the appropriate exercises and obtaining equipment. This video will also explain the role of physiotherapy and occupational therapy during your post-operative recovery and at home. Before your surgery, it is important to complete the following tasks. Arrange for a friend or relative to be available after the surgery to help with meals, exercises, driving, and to stay with you if needed. You will be prescribed walking aids and other assistive equipment for your safety and allow for more independence. Be sure to pick these up before your surgery and have them at home ready to use before you are discharged. You will be taught exercises in this video. It is important to practice and become familiar with them, as you will be expected to do them immediately after your surgery. You will review functional transfers, such as getting in and out of the car or bathtub. Nurses in pre-surgery clinic will also review other instructions. Following your surgery, you will be guided through your plan of care with the physiotherapist and other members of your healthcare team. Immediately after surgery, you can get up and move as tolerated. The physiotherapist or nurse will help get you up for the first time and subsequent times as needed. After surgery, the surgeon will order the amount of weight you can put on your operated leg. Most often, people can weight bear as tolerated, which means you can take all of your body weight through your operated leg as you feel comfortable. As part of your recovery, you will begin physiotherapy in the hospital as soon as possible. The physiotherapist will help you with your exercises. They will also help you with walking. On the day of your surgery, you will be asked to sit on the edge of the bed, take a few steps to a bedside chair, or even take a short walk. Each day, you will gradually increase your walking distance. You will likely use a two-wheeled walker to help you walk, which will be provided by the hospital during your stay. If indicated, you may also practice stairs before going home. You will be discharged once your physiotherapist and other healthcare providers deem you are medically and functionally able to go home. If indicated, you may also work with an occupational therapist to practice functional transfers, such as getting in your car and in your bathtub. It is normal to have swelling and pain in your knee after surgery. The swelling can sometimes go down to your foot. Swelling is a sign that tissues are healing. It settles down considerably within the first 6 weeks. It can persist to a lesser degree for 6 months to a year. Swelling and pain may increase temporarily while stretching or doing your knee exercises. This is normal and is not causing any damage. You may even have trouble sleeping for the first 6 weeks. Do not put a pillow under your knee while resting or sleeping on your back. There are several ways to help manage pain and swelling in your knee after surgery. You should move frequently and perform your exercises. Use ice 10 to 15 minutes several times per day on your knee. Take pain medication as prescribed, and elevate your leg as needed. A physiotherapist will help you with exercises at least once per day while you are in hospital. You will be expected to do them on your own at other times, so the exercises are completed 3 times per day. You can start the exercises the day of your surgery. Since you will be doing these on your own sometimes, it's important to review the following exercises before your surgery. Because you will be moving less for some time after surgery, keeping your lungs clear is very important. You should try to do deep breathing and coughing every hour while you are awake until you're up and moving regularly. Breathe in deeply for 3 to 5 seconds through your nose or mouth. If you place your hands on your stomach below your rib cage, you should feel your stomach push out against your hands. Slowly breathe out through your mouth, but do not force. Repeat for 5 to 10 breaths. After your breaths, try to cough strongly into your elbow. Circulation exercises help prevent swelling and blood clots. Continue these exercises until you are up and moving on a regular basis. While sitting or lying, bend both ankles up and down as far as possible. Repeat 10 times in a nice quick pace. Perform every hour you are awake. Bend and straighten your non-operated knee 10 times hourly while awake. You can attempt to do some with the operated leg as well. Heel slides. You may place a plastic sheet or something similar, like a shopping bag, underneath your leg to help reduce any friction. Slide your heel up towards your buttocks as far as possible and then slide back down. Repeat 10 times. Perform this exercise 5 times per day. As an alternative, you may do this exercise in a seated position sometimes. Quadriceps, also known as knee extension. Tighten your thigh muscles to push the back of your knee down to the bed. Hold 5 to 10 seconds. Repeat 10 times. Perform 3 times per day. Knee extension with quads over roll. Place a firm roll under your knee. A juice can or coffee can with a towel rolled around it will work. Keep the back of your knee on the roll throughout the exercise. Tighten your thigh muscles and straighten your knee to raise the heel off the bed. Hold 5 to 10 seconds. Repeat 10 times, perform 3 times per day. Straight leg raise. Tighten the muscle on the front of the thigh and then lift 8 to 10 inches up from the bed, keeping the knee straight. Hold 5 to 10 seconds. Repeat 10 times, 3 times per day. Knee flexion stretch. Sitting on a steady chair with your feet on a smooth surface, slowly slide the foot of the operated leg back as far as possible. Use your non-operated leg to help push it back further until you feel a stretch. Hold 15 to 30 seconds. Repeat 2 to 4 times. Perform 3 times per day. Knee extension stretch. Place a rolled up towel under the ankle of the operated leg. Relax your leg, letting the knee fall down so that you feel a stretch or a pull in the back of the knee. Hold for 1 to 2 minutes. Perform 3 times per day. You could do this exercise while icing your knee. After surgery, most people use a 2-wheeled walker. It helps you move faster and slides easier on carpet. The handles should be at your wrist crease when you are standing straight with your arms by your side. For walking, slide the walker forward. Push down through your arms. Step into the walker with your surgical leg and follow with your other leg. To get into bed, back up to the bed and extend your surgical leg if needed for comfort. Using your leg and arms, slide back on the bed. Turn your body as you lift your legs into the bed. If possible, lead with your non-operated leg. To get up, slide your body to the edge of the bed. Lower your leg off the bed while lifting your body until you are sitting up. Extend your surgical leg and use your arms and good leg to lift yourself up off the bed if needed. The best chair to use after surgery is one that has a sturdy back and arm rests. If your seat is too low, you can add a firm cushion. To sit, back up to the chair until you feel the chair at the back of your legs. Extend your operated leg forward slightly, reach back for the armrests, and slowly lower yourself to the chair. To get up from the chair, slide forward on the chair, extend your surgical leg, and stand up using your legs and arms for support. To go up the stairs, grasp the railing with one hand and step up onto the first step with your good leg first, followed by your crutch or cane and then your surgical leg. Continue this way one step at a time. When going downstairs, grasp the railing, place the crutch or the cane one step below and step down with the surgical leg, followed by the good leg. Repeat one step at a time. Following your discharge from hospital, it's important to continue with your knee exercises 3 to 5 times per day or as indicated by your physiotherapist. An exercise bike can be very useful in your recovery if you're able to access one. You can begin to use it as soon as you get home. Begin by just going back and forth so that you feel a stretch until you can do a full revolution. Start with minimal to no tension, up to 5 minutes at a time. This can be done 3 to 4 times per day. It's also important to schedule a follow-up physiotherapy appointment within a few days of leaving the hospital. If you plan to go to a clinic, please set this appointment up before you come to hospital. At your pre-surgery appointment, you will meet with an occupational therapist. They will discuss functional transfers, such as in and out of the car and bath. They will provide advice and education on dressing techniques. They will also prescribe appropriate equipment you will need for after your surgery at home, such as a raised toilet seat and tub transfer bench. If there are concerns about any of the above topics during your admission in hospital, they will also meet with you and practice these if needed. If you do have further questions, you can also request to speak with an occupational therapist during your admission. A raised toilet seat can bring the toilet higher and make it easier to get on and off. It's important to support your arms when getting on and off of the toilet. Some raised toilet seats have built-in armrests. If you are not using armrests, a bathroom countertop should be close enough that you can push up from it to stand. To sit, back up to the toilet until you feel it against your legs. Extend your surgical leg. Reach back for the armrests and slowly lower yourself onto the seat. To get up from the toilet, slide forward on the seat, extend your surgical leg, and stand up using your arms for support. Make sure you press up on both armrests so that the device remains steady. Never use a towel rack or a toilet paper holder to pull yourself up from the toilet. These could easily come away from the wall and cause you to fall. If you need extra support in the bathroom, consider installing grab bars. Before getting into your car, make sure the passenger seat is pushed back. If you had hip surgery, you may place a seat cushion on top of the seat if needed. When you approach your car, back up to the seat and extend your surgical leg. Using your arms for support, lower yourself to the seat. Slide back as far as you can across the seat, then bring both of your legs into the car. To get out of the car, ease your legs out and slide to the edge of your seat. Extend your surgical leg and stand up using your legs and arms for support. Use a tub transfer bench to get in and out of the bathtub. 2 legs of the bench are inside the tub and 2 are outside. You may also use a bath chair. The bench or chair should be adjusted to be above your knee height. If you had hip surgery, you may want to attach a handheld shower hose to the bench. Turn the water on before getting into the tub. Use a non-slip bath mat both inside and outside of the tub for your safety. When you reach the tub, back up to the bench, extend your operated leg, and use your hands for support to sit down. Slide to the back of the bench and swing your legs into the tub. To get out of the tub, bring your legs to the side and swing them over the bathtub. Hold on to the bench, extend your operated leg, and then push with your arms to stand up. This video was hopefully informative and will help you in preparation for your surgery. You can refer back to this slideshow at any time to review the information provided, or refer to your patient guide for total joint replacement, which was given to you at your pre-surgery appointment. If you have further questions, don't hesitate to speak with your physiotherapist or occupational therapist.